We know that about 1% of the population suffers from an inflammatory form of arthritis. While we don't know the exact cause, we do know that both genetic and environmental factors will play a role. And we know that the treatment of this disease has really revolutionized in the last 20 years. So unfortunately, 25 years ago, if you were diagnosed with inflammatory arthritis, the prognosis would have been quite poor. Whereas now we know with the arrival of the biologic treatments in 2000 and then more recently these oral molecules in 2013, this has really correlated with improved quality of life and function. So we have many medications that are currently in use today, and some of them will target proteins that we know are involved in inflammation, and that's these over here. We have medications that target the cells that we know are involved in inflammation, and more recently we have these molecules that target specific inflammatory pathways, which we know will drive inflammation. But we know that every patient is different. Not every patient will respond the same to the same medication. And that really kind of emphasizes that we have this unmet need in our current treatment strategy. So as I said, some patients won't respond, some will have a suboptimal response, and unfortunately that can also go hand in hand with side effects and adverse effects. So we also know that remission is not often achieved. So again, unfortunately, approximately only 1 in 4 patients will reach full remission, and the risk and the cost of these treatments is high. So although there have been improvements, we still have a long way to go. So really, the aim of this research was we wanted to learn more about what do patients understand about the medications that they take, their disease itself, how it was diagnosed, and we really wanted to gauge whether patients have been involved in research. Because I said we really believe that in order to improve treatments, strong patient partnerships are key. So that's really where the scientists, the clinicians, and the patients will all work together. So then to carry out this work, we as I said, we conducted a research survey. And the first thing that we did was we did this literature review. And this was to kind of gauge the questions that we thought we would address in the survey. And then we had this open discussion with a multidisciplinary team of scientists, clinicians, and patients. And this then led to the development of 27 questions, which encompassed areas such as diagnostic tests, medications, adherence, pregnancy, and involvement in research. So we had a total of 1,416 responses, and 85% of those were female. Most of the answers were a simple yes, no, but if we did want to kind of gauge patient understanding, we also had a scaling system of 1 to 10. So 1 to 3 being do not understand, 4 to 6 little understanding, and then 7 to 10 was a high level of understanding. So the first thing we wanted to do was assess the patient's understanding of their disease. So we first asked patients, did they understand what CRP was and ESR? And these are basically inflammatory proteins which are detected in the blood. And when they're raised, they indicate that there's a presence of inflammation in the patient. And what we noticed, as you can see in the blue areas here, was that greater than 50% of the respondents did not know what CRP and ESR were. So in addition to this, we also asked patients, did they understand what rheumatoid factor and ACPA were? So again, these are proteins that are found in the blood. They're called antibodies, and they're produced from a specific type of immune cell called a B cell. And what we noticed was while 2/3 of respondents understood what rheumatoid factor was, greater than 75% did not know what ACPA was. And that's really, really important because we know that ACPA is important in diagnosing inflammatory arthritis. So if you're positive for ACPA, you're more likely to have rheumatoid arthritis, whereas if you're negative, you're more likely to have a spondyloarthropathy like psoriatic arthritis. So next, we also asked patients, do they understand what the DAS score was, or the disease activity measure? So this basically is a cumulative score which takes into account swollen joints, tender joints, if you have some of these inflammatory proteins in your blood, but also a patient questionnaire which really assesses how the patient feels in themselves. And this combined is this cumulative score. And unfortunately, what we saw was that 2/3 of respondents had little or no understanding of this DAS score. So what this kind of really highlighted to us was that there really is a need to improve the communication between clinicians and patients, particularly in this area of these diagnostic tests. So next we asked patients, do you have a clear understanding of what medications do? And really reassuringly, we can see in green here that the patients do understand what their medications do. They're also very aware of the side effects. As you can see here in green, there was a high percentage that said yes, that they understand the possible side effects. But I should say that there was about 25% of patients who weren't clear or weren't sure of the side effects of their medication, and that's important. Another reassuring result that we saw was that when we asked patients, do you always take your medication exactly as prescribed? We can see that there was a high level of patients who said yes. There was 87%, as seen here in yellow, who said yes. But then when we asked those patients who said no, does your disease flare if you stop taking your medication? We can see here in green that a high percentage of patients said yes. So when they stopped taking their medication, their disease flared. And this is a really important result because we know now that when patients' disease flares, it actually becomes a lot harder to control that disease again. So I suppose the point from this was that patients should really take their medication exactly as prescribed, even if they're feeling well. Also, we know that a high percentage of patients who are diagnosed with inflammatory arthritis are in their childbearing years. So we also want to address the issue of pregnancy in this cohort. So when we asked, do patients worry about arthritis in pregnancy? We could see that a vast majority said no. But if we asked, are medications safe during pregnancy? We can see that actually there was around 92% of respondents said that they either didn't know or didn't believe that their medications were safe during pregnancy. And again, this highlights really an unmet need. So if you are contemplating a pregnancy, it's important to discuss this with your clinician. And finally, then we asked patients, either have you ever taken part in a research study or have you ever even been asked to take part in a research study? And unfortunately, the responses show that there was quite a high level of respondents who had not been involved in research. Of those that have taken part in a research study, the majority took part in the survey. Some also donated blood, and then very few were involved in a clinical trial or donated a tissue joint biopsy. So the take-home messages from this survey really were, we want to improve communication between the clinician and the patient, particularly surrounding areas such as the diagnostic tests performed, side effects of their medications and flares, and also if you're contemplating a pregnancy, to discuss your medication with your clinician, because it's really important to control inflammation for both the mother and the baby in pregnancy. As well as this, we'd also like to increase patient involvement in research studies, either surveys or blood and tissue donation, or as Vivi's going to speak about later, we'd like to involve patients at the very start, so at the design of the research study, and also in the dissemination of the research. So at the end of these surveys then, we ran these patient-focused workshops where the patient was very much at the center of these workshops, but it also involved clinicians, scientists, and patient partners. And really what we wanted to do is we wanted to discuss the outputs of the survey, but also to engage patients as to how best they can understand these topics, such as diagnostic tests, medications, and pregnancy. And then we had these very open discussions at the end of the workshops. These were based around these three key questions, and this was involving the scientists, the clinicians, and the patients. And these questions were, what are the biggest barriers to understanding various aspects of your disease? What are some ways that patients can become involved in research? And do you have any suggestions of what you would like to be incorporated in a research study? And what we saw overwhelmingly time and time again from these workshops was that these three areas kept coming up: sleep, diet, and exercise. So I suppose that kind of brings us full circle back to this symposium today. So we started off this process really trying to engage patients, trying to learn more about what they understand about their disease. And then where we've come to today is this very much patient-focused, patient-directed symposium to address these key areas that patients want to know more about. So with that, I just want to say a big thank you to all the patients who participated in the survey and the workshops, who gave up their time and gave us such valuable feedback. We are really, really appreciative. I also want to thank the Health Research Board, who funded us, Arthritis Ireland, the Research Centre in UCD, and Molecular Research in Trinity. So thank you very much.
Thank you, Mary. I hope you can hear me okay there. We've had one or two questions so far. I just thought we might actually, and we'll try and address as many of the questions we can, as we mentioned, going through the afternoon. But I mean, clearly the studies that you've described, both the survey that was online and the national workshops, have really tried to capture as much of the patient voice as possible, and to involve patients in the process. How representative do you think that the results of the survey and the workshops are in terms of patient, our arthritis patients from around the country?
Yeah, so I suppose the results that we saw were quite in line with kind of previous published results. In terms of what they understood about adhering to medication and what they might have understood about some of the medications. But I suppose what I'd say with any of these types of studies is that what we did was, mostly online. We did direct patients towards Arthritis Ireland as well, if they want to look at the survey there. But in terms of getting out information to more patients, I think one of the other aspects that we need to be aware of is that we need to actually have physical booklets in GPs, in community centres, to kind of gauge for the proportion of patients that we know that may not be online. And I know during COVID, that seems like when everybody's online because there's nothing else. But we do also need to have to cater for the proportion of patients who might not be using online resources. And so if we have more resources in, as I say, GP centres and community centres, in the Arthritis Ireland actually walk-in centre, I think that would capture a greater depth of responses as well.
Yes, and I think it's important to point out that the workshops was like a traveling show, really, because we had them in each of the regions around the country, and they were quite broadly sort of cited around the country to try and capture a very representative proportion of the community. Isn't that right?
Yeah, that's true. Yeah, so we did also do the workshops, and again, as you said, they were at different points around Ireland. So we did kind of take into account, people who couldn't travel could maybe perhaps do stuff online with the survey, and then also people who could travel. So I think it was kind of all encompassing in trying to gauge the entire population's kind of responses.
Yeah, we've one other question here just before we let you go, and that's a question which I think we get quite often when we run these sort of interactive workshops, and that is how do you get involved? So patients want to know how to get involved with the research and with the program. And I think this is something that's really important, that hopefully the message will come out today.
Yeah, and I love hearing that question, because I know that then that's a person behind that question who wants to get involved. So we do have a number of different ways you can get involved, and actually at the end of the presentation we're going to put up a slide, but there's email addresses to join our an email database. There's also Arthritis Ireland have information on their website. There's also this Arthritis Research Coalition, but as I said, we actually have, I think you're going to speak a good bit about that, about how specifically, if you're interested after today, if you want to sign up, you will be able to.
That's great. Okay. I think that's as many questions as we can address right now.